made a generic video, but this is one more specific to track athletes, sprinters, jumpers, all the above. I'm going to cut out the basic explanation. The main things that get tight or dense on sprinters, and you'll know this by just looking at your own body, is hip flexors, quads, glutes and hamstrings, calves, and then pecs, biceps, lats, and erectors. Okay? Now we're going to go through them in a certain sequence because you can't get to the true issues in some unless you unlock others first. So Hypervolt, booster, whatever you want to use, keep the setting on medium, no higher than medium. High is not better for this. We're trying to let the time under tension release it for us. Okay, think about how a massage works. Rather than just jamming an elbow in and trying to fight the muscle, you have to work through the muscle over time and let it release on its own. So we're going to let this work for us now, and we're not going to fight against it. Okay, so you have to get creative with positions. Okay, so for some things you'll be seated, for some things you'll be kneeling, some things you'll be split kneeling. This is dependent on your specific issue. So you can start by just having your leg extended like that. If you want to have it bent, I don't care. And then you have to find the place where that tissue is almost the tightest, is where it's the most stuck, and you want to work on that sticky point to unstick it, basically, because you want your muscles to be loose and free on the bone. Okay? So for a lot of sprinters, it's going to be the lateral quad, meaning the outside. Okay? So if you see, you may have heard of the IT band before, but don't think about it as the band specifically. Think about the muscle tissue that's covering the band. So you want to work that tissue, and you want to try to loosen it all up in that area. Okay? You're not trying to push it anywhere. You're not trying to move it back up. You're just trying to take that mass and break it apart in whatever direction against whatever direction it's going. And you'll find a place along that line where blood flow starts to radiate back up or radiate down. For me, it's like right around here where I'm starting to feel circulation go into my foot, go up into my lower back, and that's how I know pathways are opening up in a good way. Okay? This is going to come help us later. Okay, when we do that, do both sides, same type of deal. I already kind of know my spots. And for sprinters, it's going to be, lateral quads, and then a little bit of the groin too, depending on what kind of, what your style of running is, your body type, weight room stuff you're doing, whatever. Okay? So what's cool about this is this unlocks our ability to access our groin. So now, we have to be very careful with this, but the adductors connect your hip to your knee, and then there's short adductors as well. So you kind of work your way up in to the groin area, and remember the adductors work at the hamstrings a little bit. So we just want to keep it superficial. We're not trying to get too deep, and let time release everything for us. Okay? If you come up on a tender point or like a sensitive point where it's a little ticklish, or it's back off, there's no harm in backing off, and just kind of work around the area, because the vibrations itself will help loosen up the general neighborhood. Okay? So my leg's already loosening up, and you can hear audible pops in my ankle because of pathways that are opening up. That's always a very good sign. Okay? What it is the joint is not as locked as it used to be, so it can release, and you can use the foot rather than the ankle joint as a stabilizer. The same thing will happen in your knee and even in your hip and your shoulder, okay? Just by clearing out these pathways, okay? So when you're done with that, you've cleared your lower body, and you should feel like you have a lot more freedom to move and rotate, and that should help when you go back out to the track. Now, we have to take care of our upper body, especially if we have back problems, okay? So in order to get here, we have to unlock things first. So pecs, okay? Big muscle tissue around here. Don't get into the sternum, like this is the sternum, don't do that. Stay on the muscle tissue itself. And again, let time unlock it for you, okay? not on the joint, okay, but the muscle surrounding the joint. The delts, okay, long head of the bicep, and that'll go through here a little bit. There should be no point where you feel like you have to fight with the machine. There's sharp pain is not your friend, okay? You're gonna feel pressure because you're unsticking muscle tissue, but if you get to a point where it's like a searing sharp pain, get out of there, okay? Short head of the bicep is the part of the bicep that's by the elbow, okay? We're working on that because the elbow carries tension kind of above and below, and that short head takes the brunt of it. And you may notice that this moves things around in your shoulder and neck. So if you had some neck issues in the past, you may want to look up and down the line. So if you work on the biceps, work on the triceps a little bit, okay? Just the muscle tissue. Same thing. And I'm taking this to like 10 seconds at a time, but for everybody it's a little bit different. You're gonna find the place that needs the most help for you. And your job is not to stay on it forever. Your job is to unlock it and move to the next thing. We're just hitting the basic checklist of prime movers. Okay? Now we can start to get into the low shoulder blade and erectors area. So if you can see, the spine goes down here, and on either side, these two cable-like muscles help absorb load. And that's where sprinters and jumpers take a lot of load. So we want to be kind of careful, and we're just going to let the vibration do the work. Okay? We can change the posture just a little bit, and you see I'm working up into the most dense part of the tissue and just letting the vibration take care of it. Okay? Same thing here. You may notice one side's more dense than the other. Okay? Use your discretion to see where that would be, where you need more work. Okay? And so, at some point you're going to have to get creative with positions, lay on your side, bridge up, do the same type of thing, okay? It'll give you different stability and different positions you can hit it in. But you should notice that when you get up, you're able to be a lot more free. You may notice when you walk around, things start to crack and pop. That's very normal, okay? And you also should notice that you're able to stand in the center of your feet a little bit better and then feel your core connect to your feet. And so now you can take this back to the track or the weight room, and you can actually build upon your progress because you've brought your body back to more of a neutral place. So hopefully that tool is helpful for you, and make sure you also have somebody qualified doing your body work as well, so you get the best of everything. All right, talk to you later.